Hi, I'm Dr. Dhyanesh here, medical oncologist in Fortis group of hospitals. We have a lot of doctors in our team. We are experts in various field of oncology. We are giving advanced treatment including immunotherapy, cyber knife treatment, or biological agent and targeted therapy in Fortis group of hospitals. So today I'm going to talk about lung carcinoma. We know that lung carcinoma, it is a worst prognosis, and every year more than 20 lakh people are diagnosed with lung cancer in the worldwide. And if you count the mortality means death, it is almost 18 lakh people are dying per year throughout the world. So it's look like a lung carcinoma. It is a notorious disease. It leads to death. The thing is, if you diagnose proper way, if you treat proper way, you can avoid mortality. So early detection is very important in case of lung carcinoma. Usually, if you take the risk factors for lung carcinoma, the cigarette smoking is the one of the risk factor or the most common risk factor for lung carcinoma. Particularly those who are taking cigarette and those who are taking cigarettes, accompanying persons also risk of developing lung carcinoma. It's called second-hand smoking. And other causes like environmental exposures for those who are working in factories and asbestosis and air pollution. There are minimal risk factors. The most common is cigarette smoking. And the presenting features, you can tell what is the common features. So most of the cancers are silent unless it's reached a particular stage like stage 3 or stage 4, it start producing symptoms, unless you are doing a routine scan for screening. So usually it will not happen. So usually patient present with the advanced stage only. More than 60% of the patient present with the advanced stage like stage 3 or stage 4. In that case, cough is the main feature and breathing difficulty. If it is spread to other organs like bone or liver, they present with jaundice or bone pain. These are the common findings. So most common investigation, it is like we have PET scan. PET scan will give you idea of where is the tumor location and what are all the places it's involved. Staging, we can come to the conclusion based on the PET scan. So once we did the PET scan is the advanced technology in oncology. So once we did PET scan, next thing is diagnostic workup we have to do. So diagnostic workup we can do means it is a biopsy, doing biopsy. You can do it, say that it is a bronchoscopic guided biopsy we can do or CT guided biopsy you can do. It is very easy method. We can take just a small piece of sample we can take and we can do microscopic examination. So based on the microscopic examination, we can divide the lung cancer into two types. One is non-small cell carcinoma of lung, another one is small cell carcinoma of lung. So in the non-small cell carcinoma of lung, we have two types, adenocarcinoma and squamous cell carcinoma. So based on the histopathology, we can say it is adenocarcinoma and squamous cell carcinoma. So further treatment based on the markers we did on we are going to do on the tissue. Example, we can do immunotherapy markers like a PD-L1, EGFR, ALK, ROS, MET, all these things is important because the treatment is mainly based on the markers. So the multiple treatment options available for lung carcinoma. So first we can start with the advanced treatment like immunotherapy. So if it is PD-L1 is higher expressed, like more than 50%, we can start with single agent immunotherapy. And if it is less than 50%, we can start with single agent immunotherapy plus chemotherapy also. We can start, if no expression, we can start with chemotherapy only. So another thing is targeted therapy. If it is lung cancer, particularly adenocarcinoma patients, the targeted therapy works very well, particularly EGFR, ALK, ROS positive. In this case, just putting the tablet for the patient monthly once, just they can review 3 months once, we can do scan assessment. The best way to treat the patients. So another advanced technology is cyber knife. If patient present with only lung meds with lung carcinoma with brain meds, so in this case we can do cyber knife. Cyber knife, it is precise to only you can give radiation to the particular part of the brain, so the other normal part of the brain will be spared. The long-term side effect will be very minimal. And if you diagnose very early, the prognosis will be good. And there is multiple treatment options also available, like I said, immunotherapy, targeted therapy, chemotherapy and SBRT, and we can give bone strengthening injection also in case of bone metastasis. And we do regular follow-up like 3 months once in first year and after that 6 months once in second year, after that yearly once for 5 years. Is the minimal follow-up requirement for all cancer patients, including lung cancer also. So we have a lot of national, international patients we are treated with lung cancer. They got benefited from our hospital treatment. Thank you.